Module 3, International Healthcare, focusing on Canada and England. We will be examining England and Canada as examples of single-payer systems, both of which have some similarities, some which are very different, all of which are very different from the United States. Uh, Now also remember, a lot of these comparisons were done prior to the Affordable Care Act. Now, Canada's system is run by a single organization called Health Canada. It is a federal body and it has a Minister of Health that oversees all the health care within the country. Now, while it has that overarching system, each province in Canada is actually is responsible for administering the health care for each citizen. Each province are involved in negotiating their own fees, pay for service, does everything else. The federal system provides the funds, provides some overarching regulation, but it's the province that each individual works through in regards to its health care. Now, the healthcare system in Canada pretty much covers everything except um, issues around vision, dental, uh, prescription drugs, and so forth. There are some there are out-of-pocket insurance programs that are available that they can cover those things, and they do have government programs for those who are low-income children and so forth to cover those items as well. In regards to how this is all paid for, the system is paid for through a federal tax on income and sales. Other provinces also add additional taxes to the system. So we're looking at, in terms of federal rate, an average of 15 to 20% of one's income, depending on income bracket, goes to paying their federal system. In addition to the taxes that are used to help fund the system, there's also a system where they control the cost of healthcare, whether it's controlling the cost of physician visits, uh, the cost of hospital care, and so forth. They identify how much they would spend for each thing, and physicians, hospitals, and so forth are not allowed to charge over that amount. Uh, there's also legislation that limit Canadian insurance companies to self-promote. That is, there are limitations in regards to the amount of advertising that insurance companies can do to promote their insurance programs. That's another way that they found to be able to reduce the cost of healthcare. If insurance companies can't spend exorbitant amounts of money for advertising, that means more money. They can save some money in regards to providing healthcare. Now, England is a good example of what people refer to as socialized medicine. Now, even with Canada, where they had a federal government-based single-payer system, physician hospitals were still independent. They did not work for the government. In England, you have a National Health Service, which is funded by the government, administered by the Ministry of Health. Uh, but here, this is where you have physicians and hospitals actually being part of the government. Now, the NHS provides free care for all its citizens in England. They bill the government for the services. There is some out-of-pocket payment for patients for glasses and so forth. But generally, there's also support for children, those chronically ill, disabilities, those over 60. Now, like Canada, there's also a mix of taxes and mechanisms to control costs. The NHS is funded by income and sales tax revenues, and which also goes to pay for the salaries of medical care providers and government employees. Again, many medical providers work directly for the government. as opposed to Canada, where the government provides the services or pays for the services, but the medical personnel are independent. In England, they also have what's referred to the National Institute of Health and Clinical Excellence. Again, this is the organization that seeks to control costs by identifying what they will pay for certain medical procedures, and also the way to review the quality of that care as well. Now, the government does a lot, again, to control the costs of healthcare. Uh, for providers, they limit the amount that receives. Each provider receives a fixed amount per citizen that they see each month, but they also receive an incentive for preventative services. So, the more of their patients that they come in for preventative services, the idea there being that by identifying problems ahead of time, reduces costs in the future. They have gatekeeping also the way to control costs. The primary care providers regulate the access to specialty care. That is, in order to see a specialist, cardiologist and so forth, they first need to see their primary care provider in order to get that access. And again, this is what's a major issue that many people have talked about in regards to the English system, the issue regarding the wait periods. So while everyone can access healthcare, many may have to wait a period of time before they can actually see a doctor. And for some procedures, there are reports for upwards of about 4 months wait. Okay, we'll be looking at a set of numbers comparing the United States with other countries. Again, remember, this is also pre-Affordable Care Act, so we'll like to see some changes when we start looking at more current numbers. But one of the issues that people have been focusing on and stating that there is a need to reform the U.S. healthcare system is if you look at the total cost expenditures as a percent of GDP here, you can see that the United States is much higher than the other countries. That at 16% of GDP, or really $7,290 per capita. And if you look at some of the others, the next highest is Switzerland at 10.8%, or $4,417 per capita. So, the United States has been paying a lot of money, on average, for the healthcare, but at the same time providing healthcare to a much smaller number of individuals compared to other countries. Now, this next chart looks at those who spend more than $1,000 in the past year for healthcare out of pocket, and they've divided up between those who are above average income and those who are below average income. Basically, those who are well off economically versus those who are economically disadvantaged. And if you see, the United States is at the top. Uh, our citizens spend on average much higher out of pocket for healthcare costs than any other industrialized nation. If you look at Switzerland, is the next following, you see much smaller difference. In fact, the amount spent out of pocket is for those at higher income levels in Switzerland is actually close to what those who are economically disadvantaged spend in the United States. And then if you look at Canada being much smaller. So again, these are a number of statistics that people have used to show that the United States healthcare system is extremely problematic and is in need of reform. Now, one thing we can say about the United States healthcare system is that people who want to access healthcare can see a healthcare provider pretty quickly. And looking at this table, looking at the percentage of individuals needing to wait 4 months or more for elective surgery. Okay, so this is elective surgery, not emergency surgery. This is surgery that people can afford to wait for a period of time. In the United States, people don't have to wait too long in order to get elective surgery. Only about less than 10% have to wait 4 months or more. Whereas in other industrialized countries, looking at Canada and England, you see really a large number of people will have to wait. But we're seeing improvements over time. This is something that these countries have been trying to improve upon. And if you see in the United Kingdom, at the height of 2005, 41% uh, had to wait 4 months or more for elective care, but by 2010, that dropped to about 21%. So they are working to try and improve things. And it's also important to look at when we're talking about the United States. We're looking at individuals who perhaps have access to health insurance or some sort of healthcare in general. Otherwise, people will not have access to any kind of care at all. Whereas for these other countries, they have a national healthcare system so that all their citizens are covered. And so the argument regarding rationing of healthcare. Yes, in other industrialized countries, individuals will have to wait, and there are a lot of ways in which people are controlled or limited in regards to that kind of healthcare they could receive. But in the United States, we have rationing as well, rationing based on income or access to health insurance. So individuals who can afford health insurance or provide health care or are not employed in a job that provides health care, they pretty much do not have any health care access at all. And that's the form of rationing as well. Now looking at selected healthcare outcomes, we can also look at the effectiveness of the U.S. healthcare system versus other countries. Infant mortality rate is generally one of the mechanisms people look at in regards to how effective a nation's healthcare system is. And the United States pretty much tops industrialized nations with the highest level of infant mortality. If we looked at this based on race and ethnicity, we'll see this number being much higher compared for different races and ethnicities, with African American populations showing very high rates of infant mortality. And at the same time, you'll see that African American population will also have high rates of uninsurance as well. Looking at life expectancy, you will see again United States at the bottom. Uh, Measures of amputation, United States is pretty much at the top with about 36. Again, this results in people delaying care, not seeking preventative care, and only seeing a doctor only when a problem is very severe enough to warrant amputation. Again, admission rates with asthma also very high. So the implication here being is that because a number of people lack access to health care, people will forego health care or limit health care until it's an emergency, in which case the costs and the procedures necessary are much costlier, both in regards to the amount of money it costs, but also the cost as the impact it has on the person's health and well-being. Now, looking at the question as to whether or not the federal government has any responsibility to providing health care for its citizens, the Gallup has examined this question for many years. And looking over a period of time from 2000 to 2007, there has been a large majority of people feeling that yes, the federal government should does have a responsibility in providing, making sure that all its citizens are covered with health care in some way. But interestingly, starting with 2008 and moving forward, that number really started to decline. Why was this? Much of this revolved around a lot of the debates around the Affordable Care Act, with issues around the Obama presidency and so forth. These are some of the factors that we'll be looking at and thinking about as we look at the current healthcare reform efforts we've been seeing in the United States, and looking at how this change in attitude plays into current healthcare reform efforts.